Welcome back to live coverage of the Mackinac Policy Conference. I'm Zoe Clark, and Dr. Hanna joins us now. She is, of course, the founder and director of RX Kids. It's great to have you here.
Zoe, it's great to be here.
So, doctor, for someone who hasn't heard of RX Kids, first just lay it out. What is it? What's it doing?
RX Kids is a very simple mom-baby support program. So it turns out that families are the poorest around the birth of a child. So income drops, expenses rise, and really what happens in that short window can shape your whole life course. What baby, in utero development and that first few months of life of brain development really sets the foundation for future health. So RX Kids is just providing families with a little bit of economic cushion in pregnancy and early infancy. And what we're seeing is lots of improvement, especially in terms of health outcomes.
I want to get to those results, but what is the goal, right? Like, tell me what the end goal is.
The goal of the program is improving health.
Yeah.
It is a maternal infant health program. It is led by a doctor at a medical school. It's called RX Kids on Purpose. It's a prescription for health, hope, and opportunity. So the goal is improving health, and the goal is to scale the program, and that's what we've been able to do so far in Michigan.
Yeah. What is exactly offered?
Every pregnant person in an RX Kids community gets $1,500 in mid-pregnancy after 16 weeks of pregnancy. And then once a baby's born, it's $500 a month. In some of our communities, it goes to 12 months based on the amount of funding we're able to raise. But most communities, it's just to 6 months of age. So it's really time-limited support during this crucial window of life.
Mm-hmm. And where is the money coming from?
The money comes from all kinds of sources, and if you want to contribute, go to rxkids.org. It is a public-private partnership. So what that means is we have public money, we have state money, local money, municipal money, we have some federal money, and then we also have lots of other money from philanthropy, from corporations, from individual donors who've also decided that, hey, we can do better in terms of how we care for our babies. So we've raised a little over $400 million.
$400 million.
$400 million when you add up all those buckets of money. We've prescribed about $40 million already to thousands of families in Michigan. And our plan is that funding is the commitment to do this for the next 3 years.
Tell me about the results that you've seen so far.
The results are amazing, and it's really kind of built on extensive evidence. Other countries do this around the world. 76% of countries in the world have child allowances, where families are given unconditional monthly support to raise children. We're one of the only countries in the world that doesn't have paid leave that gives family time off when they're having a baby. Those kind of contribute to the reasons that families are so poor during this window. And we all know how expensive babies are. So what we're seeing is, number one, improved family financial stability, less evictions, a 90% drop in evictions in Flint where the program started. Families are able to make ends meet, improvements in nutrition security. They can buy the food that they want. In terms of spending, we know through multiple surveys of our participants, the number one thing families spend this money on is baby supplies. Mm-hmm. And when you break it down, it's actually diapers. Diapers are so expensive, and then all the other things that babies have to have, like cribs and car seats. And then also on food, rent, and utilities. So families are more financially stable, number one. And then we're also seeing improvements in health outcomes. Mm-hmm. And this is why we did this program. We're seeing improvements in prenatal care use. Mamas are going to more prenatal care, getting the important necessary care they need. And because of that, we're seeing population improvement levels in healthier babies. And this is an article that came out yesterday in the Lancet Public Health Medical Journal. Decreased premature babies, a decreased rate of premature babies, decreased low birth rate babies, and less babies that need to be admitted to the neonatal ICU. So lots of big health outcomes, all because we're providing families with a little bit of economic cushion.
Which you could argue then is saving money.
Yes, and that is the next bucket, is the economic development. So I'm here at a policy conference sponsored by the regional chamber. It's all about economic development and workforce. And I just came from a panel where we argued that RX Kids is economic development. Mm-hmm. So we are saving money. We're not paying for costly NICU admissions. We actually had a 30% reduction in child welfare CPS investigations, which also cost society money. So we're saving money. But more than that, we're putting money back into local economies. You can think of it like a trickle-up program. Money's going directly to moms and families, And it's getting spent locally and quickly at small businesses and grocery stores and childcare centers. And that's creating downstream jobs. Hundreds of jobs are being created in those industries, and it's creating a stimulus effect, a multiplier in those local economies.
How's the message being taken?
The program has been, by and large, bipartisan supported. We're actually in an ARCS Kids community right now. Mackinac Island is an ARCS community. It launched here in March last year. We are now in the entire Upper Peninsula of Michigan. So we are in rural, conservative parts of Michigan, and we are in urban parts of Michigan like Detroit and Flint. There has been bipartisan support for the program because it's time-bound. It gives parents choice and freedom and flexibility to best meet their needs. It's very efficient. There's not a lot of red tape. It's very little bureaucracy. So we're seeing lots of support. And our biggest issue right now is not being able to be everywhere. Mm-hmm. Everybody wants this program. Not only in Michigan but throughout the nation. So that's kind of been the biggest issue is our inability to be in as many places as possible.
I was going to ask, how are you determining where to be?
Yeah, so in Michigan, we received an investment in the state budget last year,
right,
$250 million over 3 years. So we actually had an application process for the state of Michigan, and dozens of communities applied to be part of ARCS Kids. We had a selection committee to help figure out where should we go next. Right now, it's a program for high-need places, be it the Upper Peninsula that has lots of challenges of access. The people have to drive hours to get to a birthing hospital, or be it in places where the child poverty rate is just astounding. Mm-hmm. So we're in places of high need. We're in places where match dollars have been able to be committed. Once again, it's a public-private partnership. We had to have match dollars. And we're in places that wanted the program. They had to apply and express interest. So that's how we've been able to expand in Michigan. Went from Flint, we're the first site in 2024, and within by the end of the summer, we'll be in 62 Michigan communities.
Wow. You mentioned other states and other communities. Who's coming to you? Who's calling you going, how do we do this? What other states are looking at Michigan as a model?
Many states. So we've had conversations with folks in Ohio. There's already been funding committed in Ohio. Mississippi, we have funding committed. Mississippi just declared a public health emergency because they have one of the highest infant mortality rates in the country. And they're looking for solutions to improve healthier births. Washington State, Oregon, Hawaii has funds committed. So all kinds of states, red states, blue states, Republican legislators, Democratic legislators are looking for a plug-and-play, shovel-ready solution to address really the poly crises that they're facing, be it housing affordability or the impossible cost of childcare, or once again, improvements in maternal infant health or economic development.
How was the idea hatched?
Zoe, so I have been a pediatrician for about 20 years, and it's my greatest joy to care for our kiddos. But when I'm holding a newborn in my hand, and that wide-eyed baby is staring at me and demanding a better outlook on their life. So too often where our babies are born predicts their outcomes. Just in the city of Flint, there's a 20-year difference life expectancy in different parts of our county. So it's we hear about kind of those geographic-based adversities. So I have wanted, for decades, the ability to prescribe away poverty. I do a lot of band-aiding. We do a lot of band-aiding in healthcare and social services, where we fail to address the root problem, which is often poverty. I see it every day play out in my patients and really in their blunted potentials, be it in developmental delay or premature deliveries or chronic diseases or higher rates of asthma or lead poisoning, or the list goes on and on. So this is a common sense solution that's once again done around the world. We did it in the United States in 2021 with the expanded child tax credit, where millions of families got monthly unconditional child allowances, dropped child poverty to the lowest level ever. And I saw it in my patients. They were healthier. We saw better outcomes. But that was not renewed by the U.S. Senate by one vote. So that became an added proof point that, hey, we can do hard things. We can be like other countries. And it was a reminder that child poverty is very much a policy choice. And with smart policies and programs, we can fix it. And that's absolutely what we're doing.
If you could tell someone who's ambivalent about the program, perhaps ambivalent about using state dollars, what do you tell them?
Yeah, well, I tell them it's not just state dollars. I tell them it's a whole village that has come together to support this program. We have dozens and dozens of other funders that have come in besides state dollars. But I'll share the outcomes. This is once again an academic who's leading this. We have lots of research. We have healthier babies, less premature babies. We're saving money to systems. We're saving money to Medicaid. We're saving money to the child welfare system. And if they don't care about health and they don't care about babies, I talk about the economic development angle.
Right.
That this is a smart policy to bolster kind of the economies that need revitalization.
Dr. Mona, thank you so much.
Zoe, it's great to be here.